Hello, and thank you for joining this OncLive TV peer exchange. This edition will feature expert panel discussions highlighting specific clinical information on therapeutic advances and remaining unmet challenges in the treatment of patients with castration-resistant prostate cancer, also referred to as CRPC. My name is Raoul Concepcion, and I'm the director of the Advanced Therapeutics Center at Urology Associates in Nashville, Tennessee. Participating today on our distinguished panel are Dr. Philippa Cheetham, attending physician of urology at the Winthrop University Hospital in Mineola, New York, and assistant professor of urology at Stony Brook University in Long Island. Dr. Ken Kernen is medical director and partner at the Michigan Institute of Urology in Troy, Michigan. Dr. Oliver Sartor is the Laborde Professor of Cancer Research and medical director at the Tulane Cancer Center in the Department of Medicine and Urology at Tulane Medical School in New Orleans, Louisiana. Dr. Neal D is medical director of the Carolina Urologic Research Center in Myrtle Beach, South Carolina. And Dr. Michael Williams is assistant professor in the Department of Urology at Eastern Virginia Medical School and Urology of Virginia in Norfolk. Thank you again for joining us today, and let's get started. So, let's begin this first segment by defining castration-resistant prostate cancer, or CRPC, before we move on to an in-depth review of the most recent and updated AUA and NCCN practice guidelines. CRPC is defined by disease progression despite androgen deprivation therapy, or ADT, a serum testosterone less than 50, and a rise in serum prostate-specific antigen, or PSA. We oftentimes refer to M0 disease as when there is no demonstrable evidence of metastases on radiographic imaging, as opposed to M1 disease, which is where there is a positive radiographic imaging, either that be bone CT scan or sodium fluoride PET CT. Prior to 2010, only docetaxel was approved by the FDA to treat patients that were defined as castration-resistant prostate cancer with metastatic disease. In the last 4 years, however, a total of 5 novel agents have demonstrated improved survival in metastatic CRPC and have been granted FDA approval. Cabazitaxel is a microtubulin inhibitor approved in the setting of patients who have failed prior docetaxel therapy. Sipuleucel-T is the first approved immunotherapy approved for patients in the pre-chemotherapeutic space who are minimally symptomatic or asymptomatic. Abiraterone acetate is an androgen synthesis inhibitor approved in both the pre- and post-chemotherapeutic space. Enzalutamide is an androgen receptor signaling inhibitor approved post-docetaxel. And radium-223, an alpha-emitting radiopharmaceutical approved in symptomatic patients both pre- and post-chemotherapy.